Welcome back to Crush Medical. We've got a medium/hard difficulty pediatric board question that students mess up all the time. So let's break it down. Make sure to like and subscribe, help this channel grow, and we provide more educational videos daily, so follow us. Clinical vignette. So a 5-year-old boy, fully toilet trained before age 4, now has intermittent stool leakage in his underwear for the past 2 months. Parents note he often avoids the bathroom at school and sometimes holds his stool for long periods. He is otherwise healthy with normal growth and a benign exam. What additional history best supports the most likely diagnosis in this patient? So let's quickly just break it down here. We've got a 5-year-old boy who was actually toilet trained, so that's important, right? He's familiar with using the bathroom. But now they are describing he is actually having stool leakage for the past 2 months, right? And the important thing here is that parents have noted he actually avoids the school bathroom and he's actually holding it in for long periods. He's otherwise healthy with normal growth and benign exam, meaning he's eating well, pooping well, otherwise doing well in school, right? So these are important things to just, even though it's not mentioned directly, it's kind of good to have a baseline understanding as to how he's doing overall, right? So along with this concern of the bathrooms, he seems okay. So let's kind of break it down one by one. Let's start from option E. So a pruritic perianal rash that is worse at night. So this is a really interesting option. It's a distractor, and that would in fact imply a tapeworm infection, right? So you get this perianal rash that is actually worse at night. In this case, that would be incorrect here, right? So that perianal itch worse at night suggests pinworms, not constipation-related overflow incontinence, which is most likely what this child has, right? Just a whole different diagnosis. Tapeworm, pinworms, just be aware of that, okay? So that is option E, incorrect. Next option is he refuses to use public restrooms at school. So that is interesting. The idea that this child, he is otherwise healthy, he was fully toilet trained, but when he goes to school, he doesn't use the school bathroom. And he actually, in fact, holds his stool in for long periods of time. And now he's getting these concerns where he's pooping into his underwear for the past 2 months. That kind of sounds like he might be dealing with what we describe functional constipation, right? So let's just quickly go over option D and see if it's correct, and in fact it is, right? So option D, basically they're saying that this supports functional constipation with overflow encopresis, which is basically soiling your pants, right? So stool withholding is the classic trigger, especially with school bathroom avoidance. Withholding is the mechanism, right? So retained stool stretches the rectum and softer stool leaks around the mass. So that's the point, right? The child is just afraid, maybe he's uncomfortable going to use the bathroom at school. And again, they're kids. So the context here is that he has been withholding going to the bathroom at school, and therefore it's now leaking into his pants and his underwear as he gets home. So school bathroom avoidance is the real concern here, and a textbook precipitant at this age, very common, right? And again, this also fits the clinical picture, otherwise healthy, regression after prior continence, normal growth, benign exam, right? So encopresis is usually overflow soiling from chronic functional constipation and stool withholding. So in this case, like how would we address this, right? So we would need to take measures aimed at that, whether that's having teacher support or supports within the classroom that encourage kids to go use the bathroom comfortably and address their concerns. That is the correct and effective way to approach these patients, right? For example, in other words, it's not like we need to give this child laxatives or we need to give them any medications to control their symptoms. We need to be more focused towards effective measures through mechanisms that we can use to just help this patient's symptoms. Okay, so therefore, D is actually the correct answer here. Okay, let's just quickly see the other options. A child with celiac disease. So celiac disease is interesting because it presents with malabsorption symptoms, right? That just would be incorrect here, right? So family history of celiac may matter in chronic GI symptoms. But it does not support the clinical picture here, which is essentially overflow soiling associated with constipation from not using the bathrooms at school, okay? So C, therefore, is incorrect here. Recently started on an iron supplement, so this is just an interesting distractor that has no relation to this actual clinical picture here. Iron can actually worsen constipation, but it is much weaker clue than the child's active stool withholding behavior, okay? So incorrect here, just not related to the stool withholding. And ultimately we have option A, nocturnal abdominal pain that wakes him up at night. So this is also incorrect here. That would imply something a little bit more concerning. Pain that wakes a child up from sleep points to an organic GI pathology, right? So not functional constipation, who is otherwise healthy and doing well outside of the stool concerns. This is something that's a little bit more concerning and requires workup. Okay, so if you found this content helpful, make sure to like and subscribe, and we'll see you in the next video.